Hello, listeners. Welcome to Views on Health. A pleasure to have with us back on the program Dr. Gayan Bandara, Consultant Vascular and Transplant Surgeon, National Hospital of Sri Lanka. Tonight, Dr. Gayan Bandara is going to speak on varicose veins and the fact that this condition too can lead to ulcers in the leg, and therefore it certainly needs attention and treatment. Without any further ado, the microphone is yours, doctor, to tell us how common is this condition in Sri Lanka.
The varicose vein is mostly prevalent in female, but in general around 30% of the population is affected with varicose vein. So it's a common clinical condition, and it has a lot of presentation and a lot of complications and a lot of things to address when someone is having varicose veins.
From about what age does it affect a person? Is there a particular age or time frame? Or can a younger person get varicose veins? If so, why? Against somebody older?
Yeah, in general, it affects middle age and older people, but even younger population, they have varicose vein. We have seen and we have treated. They also have varicose vein. It's not limited to middle age or older, but it can happen in the younger generation also.
So what brings about this condition? How is the vein affected?
Yeah, in generally the varicose veins are, in general people would say, is dilated veins in the leg, in the medial aspect or anywhere in the leg, usually below the knee you can see those things. So these are pathologies of the veins. In general, our body has, you have a heart, and then we call artery, main artery, who supplies blood to entire body, and for the foot also do have a blood vessel running, that is called artery. Then all these blood, we then come back to the heart through the veins. So we call it deoxygenated blood or bad blood. And those things will come towards the heart from the leg. So it usually should travel against the gravity. For that, there's a specific mechanism in healthy individual where there are specific valves inside this vein. So because of the valve, when you walk, the blood pumps up and they stay at the same location because of the valve. So that is how the normal physiology will work. But due to various conditions, this valve get dysfunction and they are not functioning properly. Then what happen is the blood which should go towards heart start to come back. We call it reflux, which supposed to go up is coming back. So when it is coming back, because this vein wall is thin, it start to get dilate, and the diameter getting bigger, and it's just normal individual, it lies around the skin, and you can rarely see, sometimes you can see, but it's not dilated as such. But when the pressure goes up, it dilates, and you can obviously see a dilated, tortuous, elongated vein along your leg, especially the medial aspect, but also entire circumference, especially below knee aspect.
So is this painful then, the fact that there is a dilation?
Yeah. So
can it be uncomfortable? You said it's visible, obviously, doctor,
yeah,
but then?
Yeah, so there's a spectrum of disease. How does it start? Generally, some people would say there is a thread vein, like a spider vein, tiny vein. It's one spectrum of this disease. That is how it starts initially. Then you had a varicose vein. This is obvious varicose vein, which is obvious dilated vein. Then they tend to start having edema, swelling of the leg, generally around the ankle towards the end of the day when they are prolonged standing. They are going to have a swollen leg. Then after, towards the end of the day, they get heaviness and the pain around the ankle and discomfort. So they usually get pain when the disease progresses.
Now, when you see this for a start, when a person notices, obviously they will want to check out why that is, because it will be something not normal.
Yeah.
Can I Am I right in saying
Yeah,
that,
yeah,
doctor?
yeah. It's not normal. Yeah.
So then they go probably to a doctor, and then the doctor, would you say that even a general practitioner will be able to identify that this is varicose veins?
Yeah. So when a general practitioner, they usually the patient will go to their family physician or general practitioner. Then when they identify varicose vein, usually the patient will come out with a complaint. Look, doctor, I have this varicose vein, it was not there. Or I have this pain, and now I have this discoloration of the foot, and there's also something like that. When they come out with the complaint, then they will see this dilated vein or thread veins or like this. Then we need to assess what exactly the problem that patient have. Sometimes we get a lot of patient because of the cosmetic concern. They are dilated veins all around the leg, so it is cosmetically concerned. They can't wear proper dresses because it's obviously visible. They come in that scenario. But later when the disease progresses, they get the complication like edema and the pain and all that. Depending on that, yes, general, as for your question, general physician can identify, then they can refer to appropriate specialist to see how and to what extent the disease has been there. So whether this need to be treated or whether this can manage conservatively or whether we need to investigate or not. It depends on the patient requirement and their complaint and their complication that has already happened.
So could you explain that step by step once the patient comes to you?
Yeah, so once the patient comes to us, we first ask the patient what is their main concern. If it is the cosmetic concern, it's obviously the correct concern that they have. Then we do a venous duplex scan. That means we map all the veins in the body, in the leg basically, to identify where is the problem. As I said before, the reflux in vein, because of the pathology is a reflux in of the blood leading to this dilatation. There are certain points in your leg that it can start. So we identify those places and we decide whether what treatment option that we should offer to this patient if she or he has a cosmetic concern. Then after, let's keep the cosmetic concern aside, then patient will have a pain, and later because of this reflux disease getting worsen and worsen over the years, then they will see some discoloration, brownish or blackish discoloration which was not there, especially around the ankle area. So that is, we call it pigmentation of the varicose vein. And then after, they might have some itchiness because of this high pressure veins and because of the inflammatory reaction happening there. You can have itchiness, and there could be some eczema like picture around the ankle. And later when the condition get worse, that is the worst condition of this condition is ulcer, active ulcer. There could be ulcer in the medial aspect or lateral aspect of the ankle, which is painful at initial stage, and then with the very poor healing because of there's a primary pathology inside why this wound is not healing. So in that case, this is the spectrum of disease. So depending on the symptom and the presenting complaint, we decide what investigation, basically duplex scan. So we customize this everything according to patient requirement. But in general, we do this to prevent ulceration, which is very difficult to heal if you don't properly treat the vein.
Doctor, in your talk the last time around on diabetic ulcers, you explained the entire process of the condition and the treatment. Now, a person who is diabetic can also get varicose veins?
Yeah, exactly, yes.
In that situation, it will be like doubly worse for the patient. Will the patient have like more issues to deal with?
Yes, exactly. So when a diabetic patient having a varicose vein and the ulcer, the main concern in diabetic patient is the risk of infection. So there are high chance of getting infection. So those patients we would advise just before having an ulcer, at the early stage when there's a pigmentation or itchiness, that is just before the ulceration. It's better to get the treatment done when diabetic is properly controlled, so there's no ulcer. So because it's like a warning sign that there are going to be an ulcer If you have pigmentation or itchiness, it's like, okay, you are going to get ulcer very soon. So if a diabetic patient, it need to get the treatment as soon as possible to prevent the ulceration, because when you have a ulcer in a diabetic patient, is further trouble the treatment plan and all that.
Thank you, doctor. So now, how would you treat this situation? Now, okay, you identify and you go step by step. And okay, the worst case scenario, as you said, is the ulcer.
Yes.
So along the line, to prevent the ulcer, you do have treatment, as you said.
Yes.
Despite that, if the ulcer does come, I mean, it erupts in the skin.
Yes.
Then what do you do from that point onwards?
So as a clinical practitioner, what we all mostly overcome the patient with ulcer. So they have a initially painful ulcer around the ankle, and sometimes it is large enough, 10 centimeter or something like that. The main issue with the venous ulcer, it is exudating. There are a lot of inflammatory fluid coming out of the wound because of the high pressure venous system and the limb swelling. First, we have to manage the ulcer when there's a venous ulcer. So there could be a superadded infection because of this fluid. Skin around the wound is macerated, unhealthy, and patient is suffering, not sleeping properly and all that. So what we initially do is you clean the ulcer properly, and we apply appropriate wound dressing which can absorb certain amount of fluid. So it will not macerate the skin around. And specifically for venous ulcer, we have to apply a compression dressing. We call it compression dressing, like a tight dressing, because their limb is swollen. We need to keep the limb compressed, especially high at the ankle, and getting lesser and lesser when you come to the knee level. Generally, some people might consider, when there's an ulcer, why this doctor is applying dressing up to the knee. That is because he has a pathology above the wound. Wound is just a representation of the pathology, but pathology lies above. So anyway, we have to compress the entire leg up to the knee with the compression to make sure that high pressurized veins, they can empty effectively to reduce the pressure on the wound and reduce the exudate, that means fluid that coming out of the wound. So generally we tend to change the dressing once a week, but if there's a significant amount of exudate, that means fluid, we might have to change twice a week. So in that way we manage the wound. With the compression, wound will start to heal. Then at the same time we do a venous mapping or venous Doppler scan to see where exact pathology is. Then depending on that, we decide what treatment, because we have multiple modalities of treatment, we decide which treatment is suited for this patient.
Now it is treatable,
Yes.
and once it's treated, can it recur?
Very interesting and very commonly asked question. Yes, it can recur, but it depends on how effectively you have done the proper treatment initially. So there have been previous technique and how do you do the surgery. Now the technique has evolved that you identify all the pathological points in the vein and you treat every point effectively, so the chances of recurrence is less. Now with the modern technologies and all that, the success rate is around more than 95% to 96%. So with the laser treatment and all that, so the recurrence is less compared to the previously.
So that's very encouraging.
Yeah.
So doctor, would this situation worsen where, like in a diabetic patient, you have to amputate? Will it happen here too? Or what sort of surgery is performed to address the wound?
For the varicose vein, we don't basically talk about risk of amputation, because there the problem is not the lack of blood supply like in diabetic, not the neuropathy and all that. So they have a persisting, discharging, non-healing, painful wound that lasting for years, sometimes for decades. There are people with ulcer more than a decade or 2 decades. So the treatment option, we have sclerotherapy. We have a specific medication called STD, sodium tetradecyl sulfate. We inject those into superficial vein depending on the pathology. And the next one is the traditional way of treating is open surgery. We give them anesthesia and cut around the groin and put some small incision and get out all the veins that is refluxing and pathological. But that was the old practice. But still that is happening effectively, and it is a successful procedure. And as it require anesthesia and hospital stay and all that, now newer technique is the laser treatment, where you don't have an incision, you don't have surgical scar, there is no cut. So you put it's a minimal access surgery. You put a small hairline wire into your vein, the pathological vein, and you anesthetize that area with a local anesthetist, and then you block that vein, which is the problematic vein. We stop that giving trouble. So with that, the pathology is out, then the wound healing is better, and if there's no wound, the chances of getting a wound is less. So with the minimal complications, yes.
I'm sure our listeners would like to know now, once you treat, you can heal.
Yeah.
Can it come back?
That's what I said before.
Yes,
it's with the latest thing, more than 95 to 96% is successful. It can come again. It's because, not exactly because of that vein is recurring. There are other veins in your leg, which is not diseased now. So it's like when you have some disease in one arm, the other arm also can get another disease later. It's like a new disease. So those things can come. But in general, with the proper technique and proper treatment, more than 96% it is successful. The recurrence is very less.
And thereafter one can move around freely.
Yes, just after
without discomfort.
Yes, that is the most advantage of laser surgery. There is a minimal access because there is no cut. It's under local anesthesia. It's like a day case procedure. You come to hospital, get the surgery done. We apply a stocking after surgery. We advise them to mobilize just even after surgery. We mobilize them in the theater, and they should continue to walk, and they can go to work. And we don't ask them to bed rest like other surgery, because there's no pain or anything. So it's after surgery they are well mobile, limited pain, and back to work.
What about the compression?
Compression is we apply a small compression bandage just because of the just after surgery we have multiple other dilated vein in the leg. We apply some foam injection, that is I said sodium tetradecyl sulfate. For some superficial vein we inject small amount of that medication with the guidance of ultrasound scan. After that we apply a mild compression to keep all the vein compressed, and on the top part we apply another compression because of the we have done the laser. So after that you can remove it in 3 to 4 days time, and that is how it goes.
And then it comes back, everything is back to normal, more or less.
Yes, it's come back to normal.
So that is good news.
Yeah, exactly. So that is the latest recommendation and the latest way of treating varicose vein. And if there's active ulcer, if you do initially when there's active ulcer, people used to not to do surgery because of the active ulcer, but now even with the active ulcer we do the laser treatment as evidence says. So if you have active ulcer, it will quicken the healing procedure more than 50% if there was no surgery. So you can still go ahead with surgery when there's active ulcer.
In fact, that was going to be my question, which you've already answered, that with the surgery and the ulcer, what is the situation? So the surgery assists in the rapid healing of the ulcer.
Exactly. What we do when you do the surgery, the target is to avoid ulceration. But if there's an ulcer, because we have eliminated the pathology, the healing is getting quickened, and as evidence, as I said, it quicken by 50%. Let's say it takes 6 weeks to heal the wound, it might heal in 3 weeks after the laser treatment.
But you will be treating it anyway till it heals.
Exactly. So after the laser treatment, we have to apply, as I said, the compression bandage to the wound, because there are some fluid coming of exudate and all that. We have to apply the compression resin until wound heals, and in the same time you can treat the varicose vein with the laser treatment. And sometimes very rare conditions you can't do the laser. It all depends on your scan and finding and all that, like that.
It's end of the day, it will vary from patient to patient.
Yeah, exactly.
Each one's condition is different.
Yeah.
Now, if you just take, coming back to the ulcer, now surgery has been done and the ulcer is being treated. But till it heals, the patient has got to be careful.
Yeah, exactly.
What sort of advice would you give the patient, like in terms of being careful till the ulcer heals?
So
mobility.
Yeah, we advise them to mobile.
Right.
Yeah, because they need proper mobility to heal the wound. So the one reason why this wound is not healing is poor mobility, because of the lack of calf muscle exercises. The veins is not pumping properly, so the vein is staying. The venous blood is staying, so it will prevent proper healing. So we advise them to have a proper walk-in after the strapping, that compression bandage.
So as against, one would think that you have this wound, you have to keep your leg up, you shouldn't move it. It's the other way. You have to keep moving for the healing process to go on faster.
Exactly.
Faster.
Yeah, during the daytime, you can continue to walk because we have applied a compression stocking, and when you continue to walk, the calf muscle work properly and the venous stain is less, though it facilitates the wound healing. But we advise them when they are lying down or sleeping, we ask them to keep the leg elevated. So then the swelling goes down. With the swelling going down, the healing is better. So we advise them to continue to walk, and when they are resting or sleeping, keep the limb elevated to facilitate the wound healing.
Just one final question, Doctor. Hygiene is very important in all aspects of our life, and especially where our health is concerned. So in this situation, one should be able to be clean, but then have you got to be careful not to wet your wound?
Exactly. So you can't wet your wound when you have a wound resin on. If you have a wound resin and if you get it wet, we have to remove it, because the whole purpose of applying the compression stocking, because of the having lot of exudate. So we apply additional the gauze, bandages and other prepared resins to absorb the exudate and to prevent the exudate or the fluid material go and macerate the skin around, and when it comes outside of the wound, it gets smelly and it's discomfort and all that. So we have to keep things dry. So that is why we apply additional gauze, proper bandaging with the cotton and everything to prevent it getting soaked. So you have to keep it clean and dry without getting wet. If you get it wet, it's better to change it.
Thank you, Doctor. And with that, time has caught up with us. What is your take-home message?
So if you have, it's in regards to varicose vein. If you have a varicose vein, depending on symptom, so I have explained all the symptom and clinical signs that you might see. So if you have any concern, it's better to consult your doctor, and from your consultant doctor, then they will refer to appropriate specialist to do a venous duplex scan, or sometime like some pregnant women, during the pregnancy they might get varicose vein. For those cases, we don't usually treat them because of the fetus. They get this dilated vein. After delivery, if they having persistent things, only we treat. So we have to decide which patient need treatment, which patient doesn't. So depending on the patient's symptom requirement, we customize according to plan. So that is why you need to seen by your doctor, and then appropriate specialist will see and decide what is the best way of treatment, whether you need treatment. If you need treatment, what treatment would be better suit.
Thank you, Doctor. And there we end yet another interesting discussion, and this time on varicose veins that lead to ulcers. To you, Dr. Gayan Bandara, Consultant Vascular and Transplant Surgeon, National Hospital of Sri Lanka, Our sincere thanks for being with us on the program and sharing your expert knowledge on this very important topic. Thank you, Doctor.
Thank you very much for having me.
Thank you, Inoka Gamage, for technical assistance. I'm Fatima Razikad saying good night and looking forward to your company next Monday, same time on Views on Health.